So there are many considerations to select a salvage therapy. One of those considerations is efficacy. We discussed that. We already reviewed the efficacy, of these agents that we spoke about in the salvage setting. But tolerability is an important, and in my opinion, cost. And that brings us to value-based care, which is very important now. We need to take into account our cost, take into account tolerability. So when I look at choosing a salvage agent, I have to look at the patient, and you mentioned age and comorbidities, and look at their prior history of exposure to the first-line therapy with VEGF-R TKI, and whether they had good tolerance or poor tolerance of the initial agent. Now, it's not always the case that if they had adverse events in the first line, that necessarily is going to carry over and have produced the same adverse event in the second line. So if you have a patient who had prior VEGF-R TKI with sunitinib or pazopanib and had hand-foot skin reaction, diarrhea, fatigue, it doesn't necessarily imply that they're going to have the same adverse events when you switch to an agent, another VEGF-R TKI, cabozantinib. They may have that, they may not have that. We've seen that when we go from one TKI to another TKI. But if a patient already received a VEGF-R TKI in the first line and they developed hypertension and they're on 3 or 4 antihypertensive medications and they have had proteinuria, then I think this is a patient where I might select nivolumab for second line to give them a break from the VEGF-R TKI that they receive first line and for the hypertension and proteinuria before. Now, but there are considerations where I would go with cabozantinib over nivolumab in the second line setting if a patient has history of an autoimmune disorder, or has prior history of Guillain-Barré, or has a history of a neuromuscular disorder such as myasthenia gravis or like. This is where I would go with cabozantinib because of real risks of developing toxicity with an immune checkpoint inhibitor. And so I think the other thing we talked about is the cost, and that's an important. So when you look at giving in the salvage setting a combination of 2 agents that are more expensive and produce more adverse events, that in my algorithm will be a further line of usage rather than upfront.